everybody. Welcome back to another episode of the Skeleton Crew. I'm your host, Jenn Callahan, and tonight I have a great guest with me. His name is Dr. Zack Timmons, and he's joining me from Texas. He's here to talk to us tonight about the company that he has co-founded with a few others called Contrast Coverage Texas, and they are providing on-site and virtual contrast coverage and supervision for different imaging services. So, Zack, thanks for being with me tonight.
Yeah, thanks so much for having me, Jen. Looking forward to talking with you.
Oh, for sure. So let's talk a little bit about contrast coverage and maybe how you and your other co-founders kind of came into this great company that you have going on.
Yeah, absolutely. Well, yeah, thanks again, Jen, for having us. So we started the company back in April of 2023. I mean, it's actually kind of a funny story. My other physician co-founder, Sam Beeger, he had a wedding and he actually just needed a little bit of money to pay for that wedding. It was beautiful, by the way. And so we started doing contrast supervision in person for a local imaging center here in Houston, Texas, and had a really good time covering for them. But as we learned more about the industry, we found that for a lot of imaging centers, 90% of them will provide contrast coverage, but up to 75% of them only provide contrast supervision 40 hours a week, and some even as few as 5 to 10 hours a week. And especially as I know that as we have an aging population, more people living with chronic diseases, we're literally in some cases curing cancer. Taking care of all of these different patients, involves recurrent imaging. And so anything that we can do to help imaging centers improve the number of hours that they're able to care for patients, the better. And so as we started to build out the company, we went from in-person supervision to virtual supervision, which is a new technology that's kind of being implemented in the space. And we've been doing that really for the past year. It's been going really well. We've been enjoying it, and it's been a great solution for our imaging centers to kind of help them take care of more patients.
Yeah, definitely a great solution. Let's kind of backpedal a little bit and maybe explain to those who are in the radiologic field who might not know this completely, and those who are listening that might not even be in the field, what is the purpose of having to have contrast supervision? Is there guidelines out there, and exactly what guidelines are there?
Yeah, absolutely. No, great question. And so, I trained as an emergency medicine physician. And so very thankful for all of our, imaging technologists and radiologists to help take care of patients who are receiving contrast every day. But essentially, multiple organizations, including the ACR, the American College of Radiology, CMS, and Center for Medicaid Services, among others, require that there is a physician available to oversee a contrast injection. So contrast, as we know, is the special dye that gets inserted via an IV, which helps with the resolution of the picture and can help radiologists identify more pathology easier. And so it's better care for the patients a lot of times if they can get this contrast dye. The downside is that occasionally patients will have allergic reactions or physiologic reactions to that dye. And in the very worst cases, anaphylactic reactions that can actually be life-threatening. And so because of that, as I mentioned, these organizations have required that there are trained staff, not only from the technologist perspective, but the physician perspective on site to care for these patients. And so really that is the key reason that contrast supervision is around. And as we were kind of talking about earlier, historically, this has been done by an in-person radiologist. And as we know, as we move to teleradiology, there's now a lot of radiologists going off-site. And so for a lot of imaging centers, it's difficult to find that person to provide contrast supervision, and that's kind of where we come in.
Right. And especially, outpatient facilities are so prevalent, at this point, because the amount of imaging services that are needed for, the general population. So hours are being extended. I can attest to that because I worked at an outpatient facility for a while in the Philadelphia region, and, imaging X-ray services might have ended at, say, 6 o'clock. However, because there was such a demand for MRI and CAT scan studies, they would go until 9 o'clock. So their hours our facility opened at 7 in the morning, but they would take scheduled patients for CAT scans and MRIs up until 8:30 at night. And as you're saying, you're supposed to have a radiologist or someone there supervising, make sure that there aren't contrast reactions. And it totally makes sense where your service comes into play.
Yeah, absolutely. And I think that's a great point too, just to the outpatient centers. To me, they're really the backbone of a lot of American healthcare. As I mentioned earlier, we have people living with active cancers, chronic conditions that need recurrent imaging. And so the ability to be able to keep your center open up a few hours later each day or on the weekends is a huge value add for patients, especially those that need recurrent imaging, not having to go to a hospital. Generally getting imaging at the outpatient center is going to be more cost effective. It's going to be more convenient for patients, especially elderly patients who, maybe can't walk from the hospital parking garage all the way to the CT area. But there's just a lot of things that it makes sense for patients to be able to get imaging in the outpatient center, and we really enable that and enable the centers to provide that service.
Yeah. Let's talk about then how you're doing the virtual portion of that. How does that, explain the whole situation? Because obviously being virtual isn't the same as being in person. And how does it go for the contrast supervision?
Yeah, absolutely. So I think, yeah, as you mentioned, the biggest transition with virtual supervision is the physician going from being on site during all contrast injections to being virtual, which in our case is through our mobile contrast units or MCUs. And so essentially what happens is kind of similar to the conversation we're having right now. We'll have one of our mobile contrast units on site at the center. We work very closely with our CT and MRI technologists to ensure that they have training, not only with the platform and the technology, but also around contrast reactions, because these are things that, depending on what center you were at before, you may or may not have received training on. So that can be kind of a little bit anxiety provoking at the beginning. But what we found is that once we do the training, the technologists are actually really empowered. They really like the fact that the physicians are there and available anytime that they need us. But essentially, if there is a contrast reaction, just like in the world today, where the technologist would generally first identify that the patient is having an issue and then contact the physician, the same process aligns. We're there on real-time audio and visual via our mobile contrast unit. We assess the patient in real time, and then we have medications actually on our MCUs, including epinephrine pens that allow for quick administration of therapies when needed. We also provide, 24-hour service to a physician hotline after contrast reactions and specific aftercare instructions that really kind of make the process from end to end like a great experience for the patient.
Has there ever been contrast reactions that have happened, during a virtual assessment?
Yeah, absolutely. Yeah. And so it's very similar. One thing that we really pride ourselves on, as I mentioned, is the technologist training. That's a big part, kind of not only the ACR recommendation and requirements for this virtual supervision world that we're living in now, but also just important for patient safety and care. We go through with our technologist every single piece of equipment that's on our mobile contrast unit so that they know how to not only dose, different pills, but also different vials that have, a little bit different mechanisms. Solumedrol is one that kind of comes to mind as something that if you haven't administered that before, it can be a little bit daunting. And so we kind of walk through the technologists to really give them the skills that if the physician does say, hey, we need this medication administered, they feel really confident in being able to do that. So
good. Is there ever a case scenario where it's an emergency type situation where the patient might have to go to, say, like an emergency room?
Absolutely. Yeah. Yeah. Any anaphylactic or anaphylactoid type reaction where we're administering epinephrine, we're also simultaneously kind of calling 911. And, as an emergency physician, I deal with anaphylactic reactions literally on a daily basis. And so, not only is it, the safest thing for the patient, but it's the right, medical and evidence-based care to kind of initiate that emergency response system. So that's definitely a part of our care, and something, again, having an epinephrine pen handy, I think also makes it just super easy to get people the right care when they need it. So
sure. I mean, that's just a quick stab to the leg.
Exactly. Yeah. And that's the great thing, right? We teach patients every day how to use those pens. And so the CT or MRI technologist that is much more skilled in administering a number of medications already, they do great with it. So
yeah. So we're talking about different types of studies that they're being used for. Is it mainly like contrast studies for CAT scan and MRI?
Yeah, exactly. Like CT and MRI imaging. We do that here in Texas as well as across the country in other states. So started in Texas, but have a national footprint now and can pretty much provide these services across the country, which has been exciting.
Yeah, that's great. I kind of think of it as like the language line that we use in my hospital. It's the little iPad that's on, a roller, and you roll it around. And, I mean,
Exactly.
in the language line, you're calling, for different languages to be spoken to the patients, but instead you're just calling a doctor to be present. So then you stay on the line during, say, a possible like MRIs can be what, 30 minutes?
Mhm.
A physician's on the line then for like 30 minutes while,
Yeah.
or are they only on the line possibly during the contrast portion of it?
So we usually will, and we'll work with centers to kind of figure out when they need us available. But essentially, any time they're scheduled for contrast injections, we will be on the line, and that's very like well kind of written out in the ACR guidelines that you actually have to be on real time audio video. And so our technicians, usually the way it works is kind of at the beginning of the day, we'll have a discussion, we'll both log on, and then we're just there if they need us at a moment's notice. So
Just to like backtrack a little bit to what you had said, that some facilities don't have physicians available during a percentage of the time during the day. It's kind of scary to think about that, patients could possibly receive contrast and have this type of reaction. Now, I feel like technologists who are administering this do have a general base knowledge. This is computer based training information that I feel like is, a backbone to what they're doing, but kind of concerning. So, I mean, great solution all around. But do you have any more information or maybe like studies that you could share with us about the contrast reactions happening and physicians not being?
yeah, yeah, absolutely. And just to clarify my earlier statement, so when we were surveying centers, they provide contrast, 5 to 10 hours a week. So it's not that they don't have a physician available outside of those. They don't have a physician available when they're giving the contrast, but it's time that they can have a physician there because it's so expensive. And maybe they're a more rural center, so they can't have a physician come in every day. And so really those are the gaps that we're looking to fill. But to your point, it's a huge patient safety issue to not have a physician on site for contrast injections. There's actually been a number of lawsuits and false claims acts across the country, including here in Texas, around instances where patients were actually giving contrast and either had a bad outcome or the imaging center, had placed a claim for a contrasted study without physician supervision. So it's a huge area of regulation that's important for imaging centers to consider. And I think one of the nice things about the virtual supervision that we offer is that we can do it generally at a pretty affordable cost for the center too. So it's kind of a win-win.
Yeah. I mean, you're helping out all around, one for facilities who, there's staffing shortages everywhere, no matter which way you cut it. And I mean, I think especially since the pandemic, everybody's kind of looking to do something virtual. So it's a
Yeah.
win there as well. But then it's also to helping out facilities in terms of, like we said, like lengthening hours, when radiologists don't possibly want to be on site, or doctors don't want to be on site, but they can still be there, part of the study.
Yeah, absolutely. And I think, the other part of it is working with a lot of radiologist groups as well, because, they're under incredible pressure these days, even in virtual radiology to be reading studies, every minute of their day. And so really for them, seeing even a single contrast reaction can really be a roadblock for their workflow for the day. And so having, a dedicated team like ours at Contrast Coverage Texas that's focused on these events that are rare, but when they happen can be very serious. And it helps the imaging centers to provide more contrasted hours and get more patients scanned, but it also really helps the radiologist and ensure that they're going to have a really reliable schedule where they're already pushed so hard to read so many studies, and that they can know that they have another physician kind of taking care of the contrast studies, contrasted reactions.
So aside from the on-site and aside from the virtual portion, you said that you also to offer on-site. Is that generally for the, Texas-based area of where you are, or have you branched out into the,
Yeah.
surrounding area?
Yeah, so we are on site in multiple states as well. So really it comes down to kind of the individual imaging center need. Most people prefer the virtual option just because there is a lot of flexibility, but some people still prefer to have a physician on site. And so we work on a case by case basis with imaging centers to kind of figure out.
So your co-founder that, kind of was doing this, was he kind of like, I don't know what you call like a moonlighter, where he was like a per diem where he was popping in and, being coverage?
Yeah, no, absolutely. That's kind of how we both got our start in contrast supervision. And then it grew from there. We just saw that this was a huge need, not only for the imaging centers, but for the radiologists too. So it was kind of a win-win for everyone.
Mhm. And we were talking beforehand that you're not staff, the doctors who are on your staff aren't necessarily radiologists, or you're just a trained physician
A lot of our physicians are radiologists,
Okay.
and that is because there are some some requirements depending on the type of facility that we cover that it needs to be a radiologist. And so we have radiologists available for those in particular centers, but kind of depending again on a case by case basis, we can provide radiologist physicians, but primarily we provide radiologist supervision.
What are the different type of requirements, if you don't mind me asking? Do you know?
Yeah, absolutely. So the kind of the big buckets are physician-owned practice, like outpatient imaging practices and hospital-based imaging centers that are in the outpatient setting. So that's kind of one of the big buckets. And then the other big bucket is something called an IDTF, or an independent diagnostic testing facility. And so particularly for the IDTFs, there are CMS requirements that you need to have a radiologist that provides the contrast supervision. And so especially for those groups, we always provide radiologist supervision for them.
Okay. Are they able to offer recommendations possibly for the scans, or is that kind of out of their wheelhouse if they're not going to do?
Yeah, ours is, we kind of focus specifically on the contrast supervision.
I sorry to interrupt. I guess I worded that wrong. I guess I meant more like recommendations in terms of the contrast for the study that's being done.
Oh yeah, yeah. We just provide the contrast supervision
Okay.
and any kind of reactions around that. But yeah, we wouldn't be dictating sort of any other care and the types of studies being done.
Have you guys seen any other companies in the area? I've never heard of this before. And do you have any competition? Sorry, searching for that word. Any competition out there that you know?
Yeah. No, as far as we know, we're kind of the only people out there doing, this type of supervision in multiple states. And so I think that I'm really excited to kind of be on the podcast today to kind of help tell people more about virtual supervision, because I think when people, and especially in the outpatient imaging world, hear about it, like you mentioned, it kind of checks a lot of boxes. It's a very flexible solution. It's affordable. It keeps contrasted studies available for more patients. And so people are really excited when they learn about it. And we're, excited to hopefully keep providing it and expanding across the country.
Yeah, I mean, it makes sense. I mean, because like you said, telecommunication, telerad, since I've been in the field, we have been working with, at least myself, I should say, not we, in a hospital system, after 9 o'clock, like we would always push all our studies to, it was called Nighthawk, and then it was called VRAD, just two different, telerad communications. So, I mean, it makes sense that something like this, that you've developed it and that it's here and in real time. Before we started recording though, you had mentioned that with the pandemic it especially makes sense, and how things have been trending.
Yeah, no, 100%. And that really, the virtual supervision, the policy set forth by CMS in the public health emergency. So that was actually the first time virtual supervision had been allowed. And, at that time there was, especially as an emergency physician, I knew that there was a lot of uncertainty around COVID. And so to keep the radiologist and other staff safe, CMS said, hey, we'll allow, two-way audiovisual supervision of the contrasted studies. And then as people started doing it, they realized it's actually an incredibly safe modality. And actually earlier this year, the ACR and CMS approved virtual supervision for the fourth time. So it'll actually be available at least through 2025, but we're anticipating that it'll be a permanent policy in the near future, while just because it's been so successful and great for imaging centers, great for the radiologists, great for patients. So
That's great. Are there a lot of contrast reactions to, say, gadolinium? I mean, I know that, the contrast that's used for CAT scan studies, I feel like it's more prevalent, possibly more so than I've heard about the gadolinium with the MRI.
yeah, the CT contrast, the iodinated contrast typically does have more reaction from kind of the different studies that we've read into. But the gadolinium, they tend to be a little bit more delayed reactions. So something that we wouldn't necessarily see in the center, but it does happen as well that there are reactions to MRI contrast. So yep, we're there for CT and MRI contrasted studies anytime.
Is there like a checklist that you have the technologist go over with the patients, say that, that they don't believe that they have a contrast allergy? For the longest time, I felt like if you were allergic to shellfish, you weren't supposed to get the iodinated contrast. Is that still part of the process?
Yeah, we work on like a case by case basis with our centers, and really a lot of those particular policies are dictated by the imaging center themselves, but we kind of do our own, internal checklist just to make sure that those best practices are in place. And, if someone has had a severe contrast contrast reaction in the past, that they're hopefully seeking that study in an inpatient setting where it can be kind of more expected and they have advanced, life support equipment available and that sort of thing, if something were to go wrong. So I think that's becoming, best practice and standard across all the imaging centers, but it's definitely something that as we, speak with each individual center, we make sure that they have policies in place for. So
Yeah. I had this question in my mind and I just lost it. I'm really sorry. But it's seriously though, the question about the shellfish, I swear, I feel like when I first got into X-ray, I remember that used to be one of the questions on the questionnaire for CAT scans, are you allergic to shellfish? And if they were, they wanted you to do a prep for it. Is that still something that's...
If there's concern, it's really if people have had, reactions to specific contrast media before. So that's something that we try to do as well when we're documenting these reactions in the outpatient space. Because I think in general, we do see a little bit lower risk population, but, even just down to the specific contrast media, if you can write that down and let the patient know. I know as an emergency medicine physician, I get, I'm allergic to iodine all the time. And we know that you can't be allergic to iodine because that's incompatible with life. But what they mean is that they had a reaction to iodinated contrast. And so, over time, the contrast media have become so much safer, which has been amazing. We used to use very high osmolar solutions, and we're using more low osmolar solutions now, just as one example. So overall, I think contrast reactions are going down, but we're also, imaging a lot more people. And so, in that way, we're probably seeing a total number of reactions a lot higher than we used to see. But yeah, we can take it on a case by case basis. And, at the end of the day, you want to do what's right for the patient. If they have any history that's concerning for, atopy or, asthma, severe other allergic reactions, and then they say they have, an iodinated allergy, it's probably something that you want to have imaged in patient setting. So,
how you were saying that gadolinium, sometimes it's a delayed reaction. Is there information that's sent home with the patient? Keep watch for this just in case.
Yeah. Usually most of our patients, and to be honest, the imaging centers do a great job of this as well. They'll usually have kind of like a post-injection kind of form regardless if they have a reaction or not. So I think that's a really good best practice that we've seen across a lot of our imaging centers. But yeah, patients kind of have that information to watch out. And then a lot of these patients, they're getting the imaging study in the center, but they're going to have really close follow-up with the physician too, who are going to be monitoring, different kidney function levels, for example. And so
you're an ER doctor, right?
Yeah.
Do you also do virtual? Contrast supervision?
Yeah, absolutely. Yeah. No, so it's fun to do kind of both. Obviously, I don't do them at the same time, but it's kind of fun to use my skills that I, have learned in the emergency department and bring them to the virtual space. So it's been fun. And one of the things I've just really enjoyed doing is talking with all of the technologists. I mentioned that the outpatient imaging is kind of the backbone of a lot of our healthcare system, but I mean, the technologists are really doing the daily work to make that happen. It's just been really fun getting to know them, and everyone has such interesting stories and they're really passionate about, great patient care. So for me, being able to do all the trainings with the technologists has been really, really fun.
Well, yeah, it's great. I mean, because you probably get it in person, working in the ER. I'm sure that I know from personal experience working in the ER, you talk to the doctors, talk to the nursing staff, you have questions about, the studies that are being ordered or the patient might. So I'm sure that you're interacting with in person and, virtual as well. So that's nice. Also to have more of an understanding of it because you're actually ordering the studies yourself, so, when you're in the ER. Just wanted to talk a little bit about you right now, if that's okay. I just want to share with our viewers, kind of, where you started pre-medicine and then how you ended up here.
Yeah, no, absolutely. I've always just had a passion for medicine, primarily because I just love taking care of people. I went to undergrad at Rice University, and we actually have an incredible collegiate EMS system. And I actually remember one of my very first cases was an anaphylactic reaction. A student had, eaten peanuts in one of our local cafeterias, and our team had responded to that, provided epinephrine, and he did great. And so, just those experiences early on got me really excited about medicine and all the things we can do to help people. And at the same time, I've always been interested in innovation and entrepreneurship. So I actually worked in management consulting for a couple of years prior to going to medical school, actually helping with technology implementations at large health systems. So I kind of have that background as well. And so I think after attending medical school at Dell Medical School in Austin, and then emergency medicine residency at UT Houston here in Texas, I've been able to kind of take all of those interests and really build them into what we're doing here now at Contrast Coverage Texas. So it's been fun to bring, the medical side as well as the business and technology and innovation side into one place, which has been cool.
Sure. You've got the whole background package, to make a great company, which is amazing. And I'm sure that your co-founders are just the same. I was saying to him before we started recording, I'm like, all right, so you went into business and then you did med school. Wow, you have a lot of schooling.
Yeah. Yeah, absolutely. It's been a very long road, but like I said, I really love what I do. I get to help people every day and work with a lot of great colleagues, technologists included. So it's been great, and looking forward to seeing kind of where things go. So
Yeah. Do you have future goals, like for, I'm sure, you always have like your 6 month, possibly 2 year, 5 year goals. Do you have a close goal for Contrast Coverage Texas that you're aiming for?
yeah, no, absolutely. I mean, right now we've been talking with imaging centers across the entire country, and so I think just getting to where we can serve even more imaging centers and help them out would be great. We already have a team of about 40 physicians that work with us. I'd love to see that double in the next year, and similarly with our imaging center groups. So really looking forward to attending RSNA this year. So that'll be really fun. It'll be my first time there, but we'll have a booth at RSNA and be able to kind of talk with everyone in the field. And I think that'll be a cool way to kind of end the year. So
Yeah, I hear that the RSNA is great. So many different people that I've talked to, just overall great experience, whether you have a booth or if you're attending, just to check out everything, it's a good experience all around.
yeah, absolutely.
Well, you guys have an amazing company going on. I have to say that, like you said, that currently at the time, you don't have any competition in the market that you know of. Who knows, maybe if you go to RSNA, someone might have listened to this podcast and someone is going to be competing with you. Who knows? But you guys truly are pioneers in this field. And it's definitely a solution that is needed for many healthcare systems and then outpatient facilities, all around. So kudos to you guys for real.
Yeah, awesome. Well, thank you again so much for having me. I think, a big thing we're excited about right now is just kind of helping share more about virtual supervision and the opportunities for not only the imaging centers and the radiologists and radiology groups, but, ultimately for the patients who need the care. So I think, just being able to provide more hours of contrasted studies, whether that's after hours or on the weekend, will really makes a difference for patients. So, and yeah, thank you again so much for all that you all do as technologists, because y'all are really making it happen. So
thank you. All right, guys, this is Jen and Zack, and we're going to say goodnight for the night. But anyone out there who's looking for assistance with the contrast supervision, please check out Contrast Coverage Texas. They're doing some great work out there for the radiology field. So, all right, see ya. You've been watching The Skeleton Crew, brought to you by xraytech.org. On the next episode, join us to explore the present and the future of the rad tech career in the field of radiology.